So we were able to help him, brought down his A1C, so he's much healthier today. His other biomarkers are looking great, and who can't feel good about that? And, you know? Hi, Mark Clermont, CEO for Cecelia Health. The company was founded in 2009 by a gentleman named David Weingard, and at a late age he was diagnosed with type 1 diabetes. And if you're diagnosed, especially at a later age, there's all sorts of complexities to living with that disease, and let alone thriving with that disease. And so David set out to create a company to not only foster that energy for himself, but help the diabetes community overall. And you don't do it alone, you do it with a lot of help, and he was introduced to a coach who helped him in that journey, in that learning journey, as well as that living with and management journey. Her name was Cecelia, and he appreciated her help so much that he called the company Cecelia Health. That was its origination, in honor of her. And along the way, the company has since grown significantly, expanded beyond diabetes management into cardiovascular disease, pulmonary disease, chronic kidney disease, all manner of support that fall within that same rubric. So now we practice nationally as a virtual clinic. We're licensed in 50 states, and we help patients, over 1 million different patient interactions just in the last year. The magic of the company is we connect you both technologically, but we're going to connect you with a human. And not only are we going to connect you with a human, you're going to work with that same human over the duration of your management process, building a relationship. The thing that worked for David, the essence of the company, was that relationship he had with Cecelia. That's the thing, the magic that we've carried forward. And it's really remarkable in today's day and age, especially throughout the pandemic, where we sit today. There's so many things that kind of intercede and intercept people, and healthcare is jagged as it is. To actually have a relationship with a person that is in your corner and helps you not only understand your disease, how to manage it, navigate it, that's really the magic of what we do. One part of the business, we are working with, again, with patients across multiple disease states. We work with health plans, we work with, physicians often refer into us, who are, in that way we act as a managed service organization, and that's one part of the business, and it's really fascinating, growing. The other part of the business is related in that life sciences is also interested in what we do. And a really magical thing happened as we started to realize that this relationship thing and the mixture of digital and human interactions foster an incredible amount of adherence. So a very important thing in managing chronic disease is that you continue to take your medications, you continue to exercise, eat right, use your devices, etc. And it has an amazing effect on adherence. It has an amazing effect on people starting their therapy. And so life sciences is very interested in this. And so this amazing thing happens. So we support patient support programs for molecules that help people with congestive heart failure, of course with different types of insulins, inhaled insulins, injected insulins, diverticulitis related drugs, blood clots, etc. And it's a fascinating intersection to see that care can be delivered through a life sciences vector along with the traditional healthcare vector. That same clinical team is in service and support. Really, I hesitate to use the whole person health word because it's so overdone. You know, what is it? But at least we're meeting patients where they are, and you know what? They're not just at the point of care at an emergency room or at a physician's office. Their point of care is actually they're reaching out to these different programs, and it's just incredibly effective, incredibly rewarding business. A number of interesting things happening. So, you know, of course, chronic kidney disease is a natural extension of renal disease in general. If you have diabetes, if you have cardiovascular disease, a lot of those are precursors to chronic kidney disease. And oftentimes with chronic kidney disease, you don't even know you have a problem until you're pretty far down the road. And so identification is an exciting thing. And There's been some advancements in some of the innovation models that CMS has put forward recently. So we are right in the middle of it in chronic kidney care, and very excited about where that's developing. So that's one area for us in the immediate future. But mostly where I'm really excited about is then you look at the intersection for, the pandemic has taught us in life sciences that even in the process, if you're a clinical trial participant, it used to be you would go to the site, you'd go to a place, you'd get your tests, whatnot. Now you have decentralized clinical trials, meaning it's a combination, really a hybrid. You go to a site, you go to you still have a telemedicine-like visit and support. And yet, what we hear over and over again is patients don't want to get lost. Participants in trials don't want to get lost. That translates well, both in the healthcare sector as well as in this life sciences clinical trial research R&D area. And so I think what you'll see for the future from us is this notion of let's help patients not get lost. It is just too easy to do in healthcare, it's too easy to do in clinical trials, et cetera. Yeah, there's a million stories. We get them all the time. So we had this recent one. We put in our long-haul trucker. And he was a long-haul trucker. He was a driver of a truck just across country, and as you can imagine, they're sitting all the time. It is really hard to pay attention to your health, especially if you have a chronic disease, if you're sitting all the time. And so this gentleman, it stands out because it's a very touching story about what he wanted to do to stay engaged with his family, and the realization that he needed to do something. And so, I won't share his diagnoses, but he was pretty far along in challenged with multiple chronic diseases. And so we were able to help him, brought down his A1C, so he's much healthier today, now in a manageable range, which is fantastic. He's dropped his weight, so we helped him with his weight loss. His other biomarkers are looking great, and who can't feel good about that? And so he's excited, and so I had this great revelation as we were talking to the team the other day. I said, aren't we all long-haul truckers these past 2 years? We've been sitting at home, working virtually. Many of us have literally been sitting just like the long-haul trucker, and our exercise has deteriorated, our social interactions have deteriorated, and that story for me was just so relevant, not just because of the helping patient, but it really brings home when you look at all of the data set that are coming forward now about the health implications, deferred health, the health implications of exacerbation of different chronic states, or the new onset of disease states. It's really, it's saddening to see how much it's happened, but two, that long-haul trucker scenario, again, we're all long-haul truckers. We need help. There's help available. And that's why you want to talk to us, Cecelia Health.